Welcome to yet another edition of COVID-19. I'm Min Sun-hee. The man who has sparked rallies against racism across the world amid the pandemic has been put to rest at his hometown. Thousands gathered to pay their respects and to watch George Floyd's journey to his final resting place in Houston on Tuesday noon local time. We send our deepest condolences to his family and friends. Meanwhile, we start the program again today, as always, with the headlines with our Kwon So-ah and Noaram. Welcome.
Hi.
Hi.
So our COVID-19 cases are on the rise again in the capital region.
Right. It's not only a couple of local infections we're dealing with right now. The sporadic cluster infections in the metropolitan area have raised the new caseload to the 50s. If we take a closer look, in fact, we have exactly 50 new cases this Wednesday. We have a total of 11,902 cases, and the death toll stands at 276 with 2 additional deaths reported. And meanwhile, the people in quarantine, there are more than 1,000 people in quarantine now, while 10,611 people have completely recovered. Now, in the span of a week, we are seeing numbers in the high 30s to the high 50s, and that is due mainly to those sporadic cluster infections in the greater Seoul area. So let's take a look at our map now. We have a dozen of new cases in the capital, Seoul, and 21 additional in nearby Gyeonggi-do province and 8 in Incheon, and also 1 case in Gangwon-do province, which we haven't been seeing lately. Also 2 new infections in Gyeongsang-namdo province, while 6 were detected at the airport. Meanwhile, 7 are imported cases today.
Right. With the pandemic projected to be a protracted affair, I understand the government now is putting efforts in improving working conditions for the medical staff.
Right. Although we haven't been seeing massive infections like in Daegu earlier this year, where it was really difficult to contain the virus, we must not forget that these medical workers have been at the forefront in containing the virus throughout these almost 5 months since the outbreak here in Korea. And now that we're in June, the weather is getting hot. And it's sweltering hot for the doctors and nurses wearing protective gear like full body suits, layers of gloves and masks, hours and hours each day. And unfortunately, 3 nurses at a COVID-19 testing facility in Incheon fainted yesterday, likely due to the heat being one of the reasons. Korea's CDC expressed concerns of medical workers getting exhausted from the rising temperatures, which is why the government released new working environment guidelines. It has reduced the working hours at the peak hours, made recommendations on lighter protective suits, and vowed to provide costs for more air conditioning.
Right. And speaking of warmer weather, the government has decided to delay a special travel period.
That was made on the heels of the continuously emerging cluster infections in the metropolitan area. The special period is aimed at boosting Korea's travel industry during low seasons, and now also, of course, being hit hard by the pandemic. While earlier, the Culture Ministry and the Korea Tourism Organization planned a 4-week special travel period to start from June 20th. This has been delayed to July 1st and also shortened by 10 days, so we'll go through July 19th now. Authorities said they will monitor the spread of the virus in the metropolitan area to further consider ways for people to safely enjoy travel as well as sports activities.
Right, so and what are the numbers looking like on the international front?
Well, let's start right off with a look at our map. As of a few hours ago, the total number of accumulated cases in the world stood at over 7.3 million, and 3.6 million have been recovered, while we have a death toll of over 413,600. Let's take a closer look at the major outbreaks here. More than 2 million cases in the U.S. with more than 114,000 fatalities. And the UK, meanwhile, has surpassed the number of infections. Now it has more than Spain. And moving over to other regions, Peru has over 203,000 cases now, a fast rise there. It is likely to soon outnumber Italy. And there's also concern in Iran with more than 175,000 cases, where a second wave was said to be expected.
And going back to South America, I understand the virus there is spreading aggressively.
Yes, alarming figures in the hotspot of South America, Brazil, and the epicenter there, Sao Paulo. According to the state on Tuesday, 334 people lost their lives due to COVID-19, a new single-day record. More than 5,500 infections were reported on that day, bringing the total to over 150,000. Nevertheless, the phased reopening of retail stores and shopping malls are scheduled this Wednesday and Thursday, with officials claiming the curve is flattening. Meanwhile, Peru, also one of the worst hit places in South America, surpassed 200,000 cases on Tuesday, with more than 4,000 new infections.
Also, a UN human rights expert says North Koreans are starving because of COVID-19.
Yes, well, it's nothing new that many people in North Korea are starving, but according to the United Nations Special Rapporteur on Human Rights Issues in North Korea, the COVID-19 response in the north has made the situation even worse. Thomas Ojea Quintana said in a statement that due to a lack of trade with the north shutting its borders with China in January, the food crisis has been exacerbated. He said deepening food shortages and widespread food insecurity are, quote, alarming. And that's why Quintana urged the international community to help with food supplies in North Korea and called on the UN Security Council to reconsider sanctions implemented on North Korea, of course, which are in effect due to North Korea's earlier provocations.
All right, Swa, thank you for that. Do stay with us for more of the domestic updates.
Okay.
Arirang, Korea's new measure to track potential patients kicked off today.
That's right. The government has been testing a new QR code system to log visitors at high-risk facilities such as bars and nightclubs. This test has been going on in Seoul and the surrounding areas, as well as a few other areas. Now, that measure has been expanded nationwide starting today. As you said, around 80,000 facilities across the country are subject to the mandatory measure. In addition to entertainment facilities, indoor sports venues and some auditoriums are required to adopt the system as well. Visitors to these facilities have got to get a one-time QR code via smartphone apps and submit it to the venue that they visit. The venue manager then scans the code and includes it in a digital customer register. Now, health authorities will conduct on-site inspections to make sure that businesses are complying with the new rules. Violations can result in a 3 million won or $2,500 fine or even a business suspension. For those worried about privacy, personal information will be stored for 4 weeks before being deleted automatically.
I see. And speaking of violations, the Prime Minister had some strong words of warning against quarantine violations, I hear.
That's right. Chung Se-kyun ordered government ministers to consider filing indemnity suits against those who violate quarantine measures. Now, these include any individual or business giving false information or not following necessary hygiene and distancing rules. He said such violations pose a serious threat to the government's virus prevention efforts as well as people's safety. He also instructed ministers to conduct inspections into high-risk facilities or other public places that have gone unchecked. Penalties may include the cost of disinfection and all medical expenses incurred from patients linked to them, as well as an operations ban. Currently, 2 major indemnity suits are underway on account of violating quarantine guidelines. The city of Daegu was preparing a civil suit against the religious cult Shincheonji for causing mass infections, if we remember, the initial hotspot in Korea. Jeju Island, meanwhile, has also filed a compensation suit against a mother who took her daughter on a tour on the island when the daughter clearly showed symptoms.
Right, and I hear there's been a major breakthrough in COVID-19 research that could help identify serious cases earlier on.
That's right. So Korean researchers at Yeongnam University Medical Center have identified 4 prognostic factors that can eventually lead to critical conditions. These include people who have diabetes, high fever of over 37.8 degrees, oxygen saturation of less than 92%. Now, any level below 96 to 98% is considered dangerous, and a blood level of what is known as CKMB, that is higher than 6.3. Now, a higher CKMB means there is potential heart damage, which could be even worse with the virus. Now, the study is the first of its kind in Korea, and it can help healthcare workers quickly determine which cases may become serious, and therefore they'll be able to take preemptive measures.
All right, Aram, thank you for that. We'll see you again tomorrow. We have the regular government briefing up next, and as we wait for that to commence, we share with you some information about COVID-19 from a recent research backed by the World Health Organization. According to that new study, a person's chances of contagion is reduced by more than 80% if he or she is wearing a face mask. Thus, health authorities here are renewing calls for the wearing of masks, especially in light of the reality that local schools have reopened, with many of the country's young students taking public transportation to and from school. Also, for those residing in Seoul, you have access to free COVID-19 tests, even if you have no symptoms. Now, this new measure comes in line with efforts to contain the contagion in the metropolitan area amid the growing presence of asymptomatic patients as suspected by medical experts. Accordingly, should you believe that you may have been exposed to the virus, please do reach out to health officials, and while awaiting your result after a test, refrain from venturing outdoors. Meanwhile, indoors, remember to ventilate at least once every 2 hours if you are using an air conditioner. And should ventilation be difficult, have your mask on to protect yourself from possible infection. And for those included in religious activities, please refrain from offline practices and do stick to online practices instead. Now, we have heard that the briefing is going to take place in about a minute from now. So what we will do is take a look at the numbers for Korea for this Wednesday. As Soa mentioned earlier on at the program, we have 50 new cases, raising our total to 11,902. 2 more people lost their lives today, raising our death toll to 276, while 22 patients have fully recovered, raising our recovery number to 10,611. Blood plasma therapy is on, so for those of you who have recovered, do donate your blood. Here now is the briefing. We'll come back to you afterwards.
부장 설명이 있겠습니다.
Let us now begin our regular briefing for the COVID-19 response. As of June 10th, today, we have 50 new cases, and the total number of confirmed cases now stands at 11,902. 22 more people have fully recovered, and about 89.2% have been recovered. And a total of 1,015 people are in quarantine undergoing treatment. Unfortunately, we had 2 more fatalities. The death toll now stands at 276, with the fatality rate standing at 2.32%. We extend our deepest condolences to the deceased and the members of the bereaved families. Out of the 50 new cases, we had 7 imported cases, while 43 were local transmissions. And out of the 7 imported cases from Americas, there were 2, 3 from Pakistan, and 2 from the Philippines. And here are some of the updates on the major domestic infections. In the Gyeonggi-do Kupang Logistics Center, we have 5 additional cases of cases being confirmed, and the total now stands at 144. And as for newly planted churches in the Seoul metropolitan area, we have 4 additional cases, a total of 92, that is. And as for the Richway in Seoul's Gwanak-gu district, we have additional cases of 93, and we also have the SJ Investment Call Center in Gangseok-gu, Seoul, which also it has made contact with the confirmed case of Richway, and we also believe that all of the 8 cases for SJ Investment Call Center have been included in the case of a Richway. 35 were the visitors of the Richway, while 57 were the contacts. And in Yangcheon-gu district in Seoul, we have additional confirmed cases, and the total now stands at 54. At the family in the Incheon of Gyeonggi district, we have a Happy Town, which is an elderly facility. We have confirmed cases there, and a total of 16 cases there have been confirmed. And aside from that, we have the Gwacheon City, one of the bases for the security military base. We have confirmed cases there, and we are conducting our epidemiological investigation and testing for that area as well. And we have been seeing a surge in the outbreak of cluster infections in the metropolitan area, especially through venues such as religious small groups and club meetings, door-to-door sales group meetings in Seoul metropolitan region. And we have seen a surge in the number of cases above the age of 65, and also their fatality rate is also increasing as well. And in Ridgeway especially, we have about 54% of the confirmed cases being over the age of 55. And as for the newly planted church as well, the ratio of the elderly citizens are also increasing. And as we have a surge in the number of confirmed cases among the senior citizens, those in the critical conditions are increasing. And recently we had 3 cases of fatalities. So we ask for the elderly citizens to take care of themselves. And we ask the elderly people to avoid any enclosed space that is poorly ventilated where a large number of people can gather together. If such an occasion is unavoidable, sharing meals and singing should be avoided, masks should be worn at all times, and frequent hand washing and sanitizing should be practiced at all times. And we also advise you to get prescriptions via telephone, and if you need to go to the hospitals, please wear face masks, and please take care of any of the chronic medical conditions that you may have, and exercise on a regular basis, take a walk, a stroll, and outdoors when it's not crowded. And the COVID-19 can spread at any facility, at any venue, under a crowded, confined, and closed environment, closed contact environment. And especially we see a high increase in the cluster infections in the metropolitan area. We ask you to avoid any social gatherings like religious small group meetings, club meetings, as well as other multi-use facilities that are poorly ventilated, including restaurants and bars. And we ask you to keep 2 meters of distance at all times and wear your face masks. Globally and here at home, we see a prolonged outbreak of the COVID-19. The global pandemic is also being worsened. And lately, globally, we have over 7.1 million, and more than 40,000 have lost their lives. And according to WHO, we also had a confirmation of the most number of cases of on-day increase last Sunday. And as many countries and many regions are easing their lockdowns, we are seeing increase in the outbreaks as well. And as Korea has transitioned into live quarantine, we are witnessing continued sporadic infections here in the metropolitan area. And therefore, we have realized how hard it is for us to systematically carry out in tightened quarantine. Until we have an effective vaccine against the virus, we cannot fight the virus, and we need to be ready to fight the virus in a prolonged period. And the quarantine authorities will also exert our full efforts, including keeping of our personal hygiene measures and social distancing before we have an effective vaccine. And we will make sure that the speed of the virus and infections could be under our control. And in the metropolitan area, which has high population density, we see continued chains of transmissions. And these chains are being connected, which is posing a risk of a massive outbreak that could occur at any time. And we see an increase of the outbreak among senior citizens over the age of 65. And as they have more social activities, they are being exposed to the virus even more. And their rates of critical serious conditions are also increasing. And in order to protect our high-risk categories people, including the senior citizens and people with chronic illnesses, we need to protect ourselves against the virus. And the only effective way to do so is wearing face masks and keeping distancing. The quarantine authorities will also continue to inspect and monitor the risk levels for the regions and devise more detailed measures and intensified measures for quarantine for the metropolitan area. Thank you very much.
Right, that was Seung-young, the head of KCDC, with Wednesday's afternoon briefing. I hear her speaking about cluster infections.
Yes, let's start with these updates on the sporadic cluster infections in and around the capital. There were mostly single-digit increases regarding these numbers of cluster infections. Single-digit might not sound that concerning, but the concern is that there are a number of these groups, including still there are new cases at the Bucheon Distribution Center. In fact, 5 new cases were added there, bringing the total to 144. And then there have been more reports of infections at a table tennis gym as well as a call center. That call center case was actually related to a door-to-door business, which was also one of the major recent cluster infections. So this is a continuous concern. And also what is a concern is that many of these people infected recently were people aged 65 and above. So Jung Eun-kyung, the KCDC chief, stressed that the number of people in that age group being infected is rising, and that's also why we have more cases of people in serious or critical condition. And currently, it looks like the recovery rate here in Korea stands at 89%, but we had over 90% of recoveries earlier. So that means that this recovery rate recently has been decreasing due to these numbers of cluster infections. So we will have to stay vigilant.
All right, so thank you for that. We'll see you again on Thursday.
See you tomorrow.
We turn our attention now to the United States, where public rallies against racism continue nationwide in the wake of George Floyd's funeral in his hometown Houston on Tuesday local time. I have Connie Lee from CGTN America live on the line in Washington with more, that is. Hello, Connie.
Hi, Sunny. How are you?
Fine, thank you, Connie. Hundreds of thousands of protesters gathered in Washington, D.C., demanding that is an overhaul of the U.S. justice system. These protests are no longer simply denouncing racism. These public campaigns appear now to be calling for tangible change. Would you agree, Connie?
Right, you're absolutely right. I mean, Washington, D.C. saw its largest protests yet over the weekend with the National Guard and U.S. military also in place all across the city. Yes, these protests now started with the death of George Floyd, right? The black man who died in the hands of a white police officer. But now it's more than just about George Floyd or in memory of him. It's about decades or generations of police brutality on black people here in the United States. Now, the anger has been built up, and these protests are now the result of generations of black people feeling that they don't have a voice in this society. Protesters are demanding not only action against discrimination and racism, but also demanding a systematic change here in the United States. For instance, there are cries to defund the police. Now, that doesn't necessarily mean getting rid of or dismantling the police force, although some may be supportive of that. But defunding police also means shifting resources from the police and reallocating funds into education or social services.
Connie, meanwhile, U.S. President Donald Trump has claimed online, and I quote, "Everything is under perfect control," unquote, and that's why he's ordered the National Guard troops to withdraw. What is the actual public atmosphere like there?
Well, Trump has tweeted a lot of different things over the weekend, and he did say it was fairly under control. And I do have to say, here in Washington, D.C., they have been pretty subdued and not as violent, and they have been very peaceful for the most part. But in his tweet, he also said that the National Guards will be going home, but they could come back anytime, he calls them back. But Americans right now don't really feel that peace. They have a lot of pent-up anger, especially from the black community, but also anger from just President Trump's rhetoric and his dealing with this whole situation. And some experts do say that Trump's actions to deploy troops and his rhetoric is actually encouraging more protesters to come out.
Connie, health authorities have been warning about the potential exposure to COVID-19 during these massive public demonstrations. And I understand that members of the Washington, D.C. National Guard have tested positive for the virus following their deployment during recent rallies in the capital. Please tell us more.
Right. We just learned that a number of National Guard troops here in Washington, D.C. did test positive for COVID-19. Now, we don't know the exact number, but they do say it is a small number compared to the thousands that were deployed here. It is a huge concern, considering that when you're protesting, you're surrounded by a huge crowd. There's also chanting and yelling, and so it does increase the risk of getting COVID-19. Also, many testing sites here in the United States were destroyed from this protest. So there's also concern that efforts to contain the virus might actually be set back. But, I talked to some of the protesters who were out, and they said they are a little bit concerned about coronavirus, but right now in this moment in history, their greatest concern is about putting racial injustice out onto the playing field and protesting about it, and they feel like that is more important than staying cooped up in their houses.
Connie, one final question. Are there any government plans in motion to rein in, for lack of better phrase, of course, these public protests that have spread beyond national borders?
Well, right now, different state governments are dealing with their own protests and violence. Some cities experience more violence than others, but there are states that are actually mulling over how to make these systematic changes. Now, President Trump, of course, is criticizing a lot of these state governors to do better, criticizing them for not quickly restoring order. But cities like Minneapolis, which has been seen as sort of the epicenter of these protests, says they are looking into or considering actually disbanding the city police department. There are no details to how that will happen or what that will look like, but it is possible. And we see a lot of different state governors and mayors speaking out against these protests, but also saying that they will re-examine how they allocate their funds into the police departments.
All right, Connie, thank you very much for making the time to join us live at this hour.
My pleasure.
Back here in Korea, in yet another weekly session of talks presided over by Prime Minister Chung Se-kyun, participants addressed ways to enhance disaster management and to cope with the changes in diplomatic relations. We have more in this report.
The 6th edition of the Thursday conference held on June 4th focused on the changes that are forecast to take place in the daily lives of ordinary citizens in the aftermath of COVID-19.
위기 상황에서 개인의 자유를 일부 제한하면서도 국민적 동의를 바탕으로 민주주의의 기본 원칙을 끝까지 견지했습니다. 국민들께서는 양보와 배려의 마음으로 사회적 거리두기에 적극 동참하시면서 생활 속 민주주의를 실천해 주셨습니다.
The 6th Thursday conference highlighted the importance of disaster management in the post-pandemic era.
우리가 이번에 코로나 위기를 극복하더라도 바로 다음에도 엄청난 어떤 위기 상황이 올 수도 있다라고 가정하는 게 필요하고, 이게 이제 이른바 뉴노멀이라고 할 수 있는 거죠. 재난이 일상화되고 여기에서 우리 정부가 미리 준비하고 기회를 탐색해보는 노력들을 한번 좀 해보면 어떻겠느냐라고 생각을 해서요.
The expert also called on the government and the private sector to work together in forming of a quick response system.
지금 이제 저희와 같이 민관이 같이 모일 수 있는 그리고 신속 위기 대응팀, 이거는 사실은 이제 민간한테도 실제 권한을 좀 부여할 수 있는 이런 것들이 필요하겠고요. 특히나 중요한 게 이러한 형태의 위기라고 하는 게 어떤 부처 위기가 되는 것이 아니라 종합적으로 이제 해서 종합적 대응, 협력적 대응, 융합적 대응, 협업적 대응이 굉장히 중요한 가치가 될 거라고 생각을 합니다.
Experts also called on the country to make speedy adjustments in the face of sweeping changes in the world's geopolitical balance of power.
코로나19 사태로 인해서 드러난 양상은 미중 간의 전략 경쟁이 훨씬 격화되면서 소위 말한 뉴노멀의 시기가 우리가 시기에 직면하고 있다, 이런 얘기를 하게 됩니다.
The shifting balance of power is a crisis and an opportunity at the same time for Korea, and the expert recommended that the country forge its own unique path by promoting its own unique brand of democracy, as well as leveraging the power of K-pop and K-quarantine.
K-모델이라고 우리가 할 수 있지요. 산업혁명을 성공시켰고요. 그리고 민주화를 성공시켰고 K-pop 전 세계를 열광하게 했습니다. 이번에 K-방역까지. 그와 함께 끊임없이 명민하게 국제관계를 이해하고 경제 상황을 이해하고 외교 안보와 경제를 결합하고 과학기술을 동시에 결합하면서 우리의 전략을 만들어낼 수 있는 그 리더십과 그리고 집단적인 어떤 노력이 필요할 시기가 아닌가 그런 생각을 해봤습니다.
The Sixth Thursday Conference yielded many fruitful discussions on the role of governments and international relations in the post-pandemic era. These weekly meetings will continue to serve as an important platform to discuss various issues tied to COVID-19 and prescribe relevant solutions in the hopes that the country can eventually emerge from this crisis stronger than it was before.
Over in France, authorities are seeking to re-establish a sense of normality by permitting the resumption of businesses for restaurants and cafes, while restricting that of large-scale public festivities, that is, as health authorities continue to highlight the importance of social distancing. For more on the situation there, I have the Consul General Kim Young-joon at the Korean Embassy in Paris live on the line. Welcome to the program, Mr. Kim.
Thank you for inviting me.
Now, the Cannes Film Festival and the Bastille Day Parade have been cancelled in light of the pandemic, but France is nonetheless taking gradual steps to transition out of its state of lockdown. What can you tell us about the latest situation there?
Let me explain briefly the corona situation here in France. Until today, France has had more than 154,000 confirmed cases and almost 30,000 deaths. The recent coronavirus positive rate is 1.6% compared to the 25% at the peak. At the peaks in March and April, 25 per 100 tests were positive, while 1.6 per 100 tests are positive now. It's a big progress. Considering this progress, on June 2nd, last Tuesday, the French government lifted almost all the containment measures except Metropolitan Paris and Guyane-Mayotte, two overseas territories. These three regions lifted their restrictions partially and will continue to do so gradually when cases drop. Actually, here in Paris, people are enjoying their freedom at only outside of the cafes and the restaurants. Public gatherings limit 10 persons at maximum. That's why we cannot see these ceremonies in Cannes and Paris this year. The French government may lift the lockdown wholly on June 22nd, which is the second starting day of the easing phase. At the end of this month or early next month, the government is considering reopening its border if cases drop. With easing the lockdown, the government adopts the track and trace system like Korea. These systems are gearing up well. Under this situation, people believe that the virus is being under control. According to the French Prime Minister, living with the virus, France should move forward cautiously. Thank you.
Mr. Kim, public rallies supporting the Black Lives Matter campaign are taking place in France as well. Are these massive gatherings sparking fresh fears of COVID-19?
Yes, there are lots of actually concerns on the potential second waves of the virus. Look at the current infection cases, which record several hundreds per day. Some experts also warn about the danger of many asymptomatics. That's why the French government eased the lockdown progressively. If cases rise again, there's always a possibility of re-tightening the restrictions. In this light, on the day of easing the containment measures, the French Prime Minister stressed the cautious nature of the easing the lockdown and a readiness to back to the containment if necessary. However, the problem is economy. During 2.5 months lockdown, the French economy suffered severe shocks with more than 10% loss in GDP. The lockdown costed a lot. We know there is a trade-off between the cost of easing the lockdown too soon and the cost of the delay. Their compromising solution will be a progressive easing with caution, like the French government does.
Starting from today, Mr. Kim, Korea has mandated a QR code system to log visitors at high-risk entertainment and sports facilities. Now, earlier, French media claimed that some K-quarantine measures violate privacy rights. What is the actual response in France regarding Korea's containment efforts?
Yeah, during this pandemic, more than 10 French media covered Korean stories on tackling COVID-19 every day. They considered Korea a model of success in managing this pandemic. The experts in well-known French academic institutes praised Korea for containing the virus without shutting down. The French government also adopted a similar strategy and measures relying on Korea's 3 T's: testing, tracing, and treating. When it comes to the tracing system and privacy, all democratic societies seek to find a delicate balance between them. French government also looked for ways to find a solution that can be accepted by the public. In this context, Korea was seen as an inspirational model for France. In French parliament discussions on using smartphone tracing application, Korean systems were quoted many times as a model case, and French Senate even issued a positive report on Korean prevention measures against COVID-19.
I see. All right, Mr. Kim, the Consul General at the Korean Embassy in Paris. Thank you for joining us at this hour with your thoughts.
Thank you for inviting me. Thank you. Bye. My pleasure.
You're welcome.
본 사업이 시작되는 6월 10일 이후에도 6월 30일까지 계도 기간을 두어 제도의 안착을 지원할 예정입니다.
Starting from today, visitors to high-risk entertainment and sports facilities will be required to create a one-time personalized QR code to be scanned at the entrance. The requirement comes in line with the government's adoption of an electronic registration system to keep track of people who visit these venues. Now, understandably, the new measure, that is, has some Koreans feeling uneasy about their personal information being monitored and stored, albeit for 4 weeks. For more on the efforts to balance public health and civil rights, I have here in the studio attorney at law Kim Young-joon. Welcome to the program, Mr. Kim.
Thank you.
And I also have Professor Tak Sang-woo from Seoul National University. Welcome, Professor Tak.
Glad to be here.
Professor, we'll start with you then. How effective do you think this new registration system will be in containing COVID-19?
Oh, I think this system helps in many ways. First, it reduces the possibility of missing one patient or case that might be missed, and this person, without knowing she or he is infectious, this person can spread the virus to many people, up to hundreds and thousands. So this reduces a lot of burden on the central government who is responding to this pandemic.
Meanwhile, critics claim that the QR code at its worst may heighten government surveillance over its people. How do you respond as a lawyer, Mr. Kim?
Yeah, when the people mention QR code in the context of the COVID crisis, they immediately think of China because Alipay and other network providers came up with the system of coding individuals, every Chinese, red, yellow, and green. This is a totally different system. This is designed for a specific purpose of identifying who had been to one of the 8 types of premises where there's considered to be high risk of infection and popular density. And the 2 pieces of information, QR code and the personal identifying information, are kept separately unless and until there's actually determined to be an infection from the venue. Those 2 pieces of information are kept separately and discarded after 4 weeks. So I think it is reasonably well designed so that the personal data is protected. But again, the trick is really how to manage it properly. So if there's one mistake, one erroneous disclosure, and that really destroys people's trust in the system, and that's really the key. So, because the trust is really based for the success of the system.
Of course.
Yeah.
Professor Tak, you previously worked at the U.S. Centers for Disease Control and Prevention, and speaking within your capacity as a former member of such an entity, how would you assess Korea's speed and scope of testing and tracing?
It is actually incredible to see how quickly they can perform outbreak investigation on the field, because one epidemiologist find a case, and this case might have a contact with dozens of people, and these people who have been exposed and have potential to spread the virus can reach up to hundreds, if not thousands. So Korea has been successful in finding those people and contain the virus after all. So.
Right. Meanwhile, Mr. Kim, as part of efforts to stem the spread of the COVID-19, countries around the world imposed travel restrictions and lockdowns. Some assert that there are governments that are using this pandemic as a pretense to perhaps consolidate their power over their people. What are your thoughts on this?
Yeah, in terms of specifically on the border closing and the travel restrictions, they have been adopted by many countries, including leading democracies like Scandinavian countries, Australia, and New Zealand. So putting that aside, generally speaking, I think there's a legitimate concern about the tendency you just talked about. But interestingly, if you look at the array of so-called Western liberal democracies, the two countries that have most difficulty struggling and containing the crisis are United States and United Kingdom. And the difference, I think, in my view, as well as some of the experts' views, is those two countries are led by populist authoritarian leaders who basically are dismissive of early signals of imminent danger, whereas the other countries, even including Spain and Italy, where they had the early sufferings, but there were more checks and balances, they were more effective, and ultimately they're now coming out of the crisis compared to the other countries. So ironically, I think it's for the better. The net result is countries with better democratic checks and balances have come out of the crisis better than authoritarian leaders in democracies. So I think the concern is legitimate, but I think fortunately the results are actually the opposite.
Right.
So transparent liberal democracies, I think Korea is one of them, which is, I think, widely recognized as a successful case of managing the crisis transparently. Yeah.
Professor Tak, staying with such concerns, some governments have moved to curb civil rights by engaging in media censorship and imposing restrictions, severe restrictions that is, on online social platforms. Has COVID-19 become a crisis of democracy as much as it is a crisis in health?
Well, any public health events can lead to a disaster that has multiple effects, and it can have different and adverse effects on the society. That's why we call it a public health emergency when that happens. When that happens, I think we should make sure that whatever we do, whatever measures we come up with to prevent and mitigate the disease, has the effect we want to have, but also it may have adverse effect if we haven't foreseen. So that's why we have to have a mechanism to bring in an expert to look at the measures and foresee any kind of adverse effects on the society, on the vulnerable populations. And I think it's time for us to bring in all those great minds and think about how we can have something that we can agree on and move on from there.
Mr. Kim, now amid this pandemic, there are public protests worldwide against racism following the death of George Floyd. How do you foresee the future course of these worldwide movements against discrimination, against abuse of authority?
Right. The current political climate is really a perfect storm of a number of things, basically economic inequality, not just within a society or country, but really between countries as well. And then the fact that the most vulnerable parts of the population in any country are the ones who are forced to continue to work and face the risk, whereas some of the better off people can basically self-isolate more easily. So all of those things are coming out in a perfect storm way. And so it's not just anti-racism within the United States, but which also triggered the anti-colonialism history in Europe regarding former European colonial power. So I think in a positive way, a lot of these festering issues that apply globally have come under a perfect storm condition, and hopefully people will no longer be able to deny the problems exist, and hopefully we can work together towards some common solution. I know it's not going to be easy, but this is a necessary step to arrive at that understanding and hopefully coming up with measures to fix the problems.
Right. One final question to Professor Tak then. Turning back to Korea, contact tracing and infectious parts disclosure, open disclosure of infection parts, they are key components in Korea's containment efforts of COVID-19. But this, however, has not been looked upon kindly by human rights advocates, and Seoul's top diplomat Kang Kyung-hwa recently had an interview with a foreign journalist who asked some very tough questions. What is the official Korean stance on this matter, on such allegations of privacy rights abuse?
Well, first of all, I think there was a misunderstanding about how Korean government has been dealing with the public private information. And the central government has been very cautious about releasing private information, but also local government has the discretion on what kind of information that can go out to the public. And it has been mostly local government who has been releasing the private information. So central government is aware of the need for balance between the human rights and the public's interest. And I think there has been a learning curve for the government side. But I think it's time for us to think about all together and what kind of and how far we can tolerate until certain loss of our public interest can be taken.
So we are making efforts to seek a balance between public health and
Absolutely.
privacy rights. All right, Professor Tak, thank you very much for your thoughts. And Mr. Kim, as always, thank you very much for being with us today.
Thank you.
Thank you for having me.
Right, and on that note, we end Wednesday's coverage of COVID-19. We'll be back tomorrow at this hour with a look at new research on the virus and efforts to better contain it in light of that new information, that is. In the meantime, do reach out to us with your thoughts and inquiries through our social media accounts or homepage, Arirang.com. Do take care.